in the future, if there's a topic that you want to learn, we want to be able to provide value for you guys and teach you some of that education. Okay, so we're going to get started here. There may be one extra person coming. There's always that last person, so give them a round of applause when they come in, and just be really embarrassing. Okay. So bone health. Let's talk about it. So kind of break this down for you. Can you guys see back in the back? Is there glare or anything? Okay, so we're going to be talking about some bone fundamentals tonight, going into some bone conditions, tips for how to strengthen your bones, as well as some things that are causing a weakening of bones. I like for you guys to answer questions as we go along. So if there's anything that I say that's confusing or you need a little bit of clarity on, just feel free to raise your hand. We'll go through that. Okay. So I started to think about this quote as I was prepping for this workshop, and as I was kind of telling other patients, hey, this upcoming month we have a bone workshop coming along. It was kind of funny because people that I would talk to, some people over 50 would say, well, I'm too old to learn about my bones. I'm too far gone. And then younger people, they don't care because they're healthy, right? So when is the best time to plant an oak tree, guys? The best time is really 50 years ago, right? And the second best time is right now, right? So I agree with you, Chris, right? So wherever you are at, whether it be you're someone in your younger years, someone in your younger years watching this down the road, or you're later in life, the best time probably was 50 years ago, but we can always start right now. And the research shows that there are active things that you can be doing as you are in your golden years that can help you create stronger bones, right? So here's this kind of the trends that we're seeing with weakening of bones. So everyone in here is familiar with osteoporosis. I would assume so, right? So the recent trends of osteoporosis, when we look at 2007 to 2018, the rates have gone up about 10%. Why? I try to be somewhat cute when I talk to people about their age. I say, you're in your golden years, you're a lot more seasoned. You guys have probably heard me say this to you. You're like, oh my gosh, Dr. D. Yes. And older people, they just like to be called old, apparently. So there's more old people. That's the reason why. There are more old people now than, we have a higher demographic, right, of baby boomers that are transitioning into elderly life, right? So we're seeing more people, 50 years and older in this country. They also attribute it to a sedentary lifestyle. I think about even after 2018, we think about COVID and more people at desk position jobs, either at their house. We now live in a society that you can wake up, roll out of bed, go right into your desk in your bedroom, work for 10 hours, and then roll back into bed, right? So it's more sedentary than ever. Diets deficient in calcium, especially in urban environments. With the trends that we're seeing people move in, more people are leaving the rural areas and they're going into these more denser populations, which have lesser means of food. When we talk about food deserts and so forth, long-term use of certain medications are also attributed to our bone loss. And we're going to talk about what types of medications limit your bone density. Yes?
When did we start testing for osteoporosis?
That is a great question. As far as the history of that, Sydney, I don't know. I can't give you a full answer on that, but I'm sure it's been.
How did you had osteoporosis? Like, in my mother's generation, I don't know.
That's a good point. I don't know that off the top of my head, but I'm sure.
Oh yeah.
I'm sure a quick Google search, you could find that. But some more trends when we look at women, when it comes to bone loss, women are more predisposed to bone loss than men, but not to say men, you don't need to worry about it. But after 50 is when we really start to see this go on. So typically every year after 50 years old, women will typically lose 1 to 2% of their bone mass every year after 50. Total loss between 50 and 60 years old is about 10 to 20%. There's some studies that show that women can lose 20 to 25% of their total bone mass. 20 to 25% of their bone mass just 5 years after menopause, which I think is a lot, right? Almost a quarter of your bone mass within 5 years. Total loss by 80 years old is about 30 to 50%. For men still lose bone at a less rapid pace, but we're looking at about 0.5% to 1% every year after 50. Men may lose up to 20 to 30% of their bone mass by 80 years old. Okay, so Just some bone health one-on-one for you guys. When we think about our bones aid in the natural structure of our body. They aid in protection. They store essential minerals and nutrients like calcium and phosphorus. Our bone marrow, the bone marrow is found in the inner portions of the bones. Our bone marrow produces red blood cells, white blood cells, and our bone marrow is actually really important for our immune system. Did you guys know that? Right, very important for our immune system. When we think about someone who has like leukemia, leukemia, that's an issue with the bone marrow, right? And those people, they get sick more often when they have problems with their white blood cells, right? Put together some unique bone facts for you guys. So did you guys know that your bones are constantly remodeling? You get almost 10% of your skeleton replaces itself every year. Babies are born with 300 bones, but many fuse as we grow into adulthood, and that goes down to about 206. The outer layer of bone has the equivalent strength comparable to steel. So if you took a cubic inch of bone, that could weight bear the load of about 5 cars. Just 1 cubic inch of bone. It's also important to think about, you guys are in a chiropractic office. You guys know that we talk a lot about the nervous system. And when you think about the nervous system, there's 10 systems in the body. It's the only system that's fully encapsulated in bone because it's so important, right? Okay, let's go over some facts and myths about our bones. Okay, so myth number 1, only older women need to worry about bone health. What do you guys think? True or false? False, right? Okay, so here's the facts. Women over 50 are at a higher risk due to a lot of the hormonal changes that we see. We're going to talk about what changes during that time. But 1 in 4 men over 50 will have an osteoporosis-related fracture. Younger adults need to build bone mass in their 20s and 30s. So our peak bone density happens when we're in our late 20s and our early 30s. And essentially, it's all downhill from there. Okay, so it's really important that, some of you have grandkids in here. Some of you have younger children, right? They need to have this conversation now about building their bone density reserve. You got to get that at the highest possible point now, because once you get out of your 30s, then it's downhill. Okay, but there are ways that we can slow that progression, as well as not get to our peak bone mass when we're in our 30s, but still raise it, well into our 70s and our 80s. Okay, myth number 2, drinking milk is the only way to get enough calcium. False, right? Okay, we're going to talk about other types of foods that can improve or that have way more calcium than milk, but milk is not the only way to get calcium in your body. Leafy greens such as kale, almonds, canned fish with the bones in it, lots of calcium in those types of foods. If you don't have symptoms, your bones are fine. False, right? Bone loss, especially in conditions like osteoporosis, starts silent. When we think about osteoporosis, cancer, subluxation of the spine, all these issues are chronic diseases. Chronic diseases start silently. Okay, over time, that's when we start to notice the issues. Okay, unless we get it, of course, checked or tested. Okay, you can't build bone density after 30. I've kind of already alluded to this. We all know this is false. There are many things that we can do after 30 years old that can strengthen our bones. Okay, so let's go a little bit into some bone anatomy. Everyone has heard of collagen? Okay, collagen is good. Collagen helps give our bones its resiliency. When we have blunt trauma, it gives our bones a little bit of flexibility so it's not brittle and breaks, right? Okay, hydroxyapatite. Anyone ever heard of this? Okay, so this is a crystal-like compound that gives our bones its strength. Okay, it's made of calcium and phosphate. That's why when we hear about bones, we want to take a lot of calcium, right? We want also a lot of phosphate. Okay, water. People always talk about water is so important. Well, this is one of the many thousands of reasons why water is important. Our bones actually do have water in them. That helps aid in the flexibility and the transport of certain nutrients into our bones. We get certain nutrients and toxins kicked out of the bones and nutrients put into the bones. Okay, and then we also have different types of bone cells. Okay, so we have what are called osteoblasts, osteoclasts, osteocytes. Certain cells build bone up. certain cells kind of chisel and reshape our bones. Certain cells destroy necrotic bone tissue. Does that make sense? I haven't lost anybody yet, right? Okay, good. Okay, and then lastly, we have the bone marrow. When I think of bone marrow, I think of this. Oh yeah, right? Put that over some toast, right? So good with your eggs, right? So bone marrow is the center part of certain bones like our femur or pelvis, right? The bone marrow, its role is to produce red and white blood cells and platelets. Our bone marrow produces about 2 billion red blood cells every single day. Okay, and like I said earlier, the bone marrow plays a huge role in our immune system. Okay, so we're gonna go over some different bone conditions. So the first bone condition I have for you guys is called osteopenia. We're familiar with osteopenia, right? Okay, so this is a precursor to osteoporosis. This is when our bone density is normal. It's less than normal, but it's still not at an osteoporotic level yet, okay? Really, when it comes to osteopenia, when a patient comes in and says that they have osteopenia or even osteoporosis, it is definitely a warning sign, but I don't see that as a huge red alert, like you need to go to the hospital right now. It's just your bones are starting to become weaker, okay? Usually asymptomatic, meaning you don't have any symptoms. This is really detected through bone density tests. Osteoporosis, this is someone who's at a higher risk of certain fractures. Now we have patients in this room who have osteoporosis. I see patients every day that come in with osteoporosis, and that for a lot of people is a hesitancy as far as seeing a chiropractor because, if they adjust me, am I going to have my spine broken? Am I not going to be able to walk out of here, right? So that's why testing is so important. We have to take an X-ray to see what areas should we adjust, what areas should we stay away from, right? So osteoporosis is related to aging, hormonal changes, certain toxins that we're exposed to. We're going to talk about that here later. 1 in 2 women over 50 years old are at risk for osteoporosis, as well as 1 in 4 men over 50 years old are at a risk for osteoporosis. Fractures. Can anyone say what a fracture is? Broken bone. I thought this is a really smart group of people, but the other day I was talking with someone. I was like, "Yep, you have a fracture in this area." And this is, "What's a fracture?" I was like, "It's a broken bone." And I said, "Really?" It's like, "Yes, it's fracture. It's like sometimes not common for people to understand, right?" So breaks or cracks in our bones. Fractures can be related to trauma. Like when people think of a fracture, they think of falling off a ladder or a car accident. But when it comes to many of the osteoporotic cases that we see in here, these are from day-to-day repetitive, not moving types of traumas that slowly over time collapse the bones. Okay, I'm going to show you some x-rays of that here. Okay, osteoarthritis. Now, osteoarthritis, this is a joint condition that affects our cartilage, and over time when the cartilage degenerates, it causes the bones to start to rub together, and then the bones start to collapse in size, and we start to see bone spurs forming, right? These are all signs of arthritis. You guys have all heard of arthritis. So when your doctor says you have arthritis, degeneration, osteoarthritis, bone spurs, decreased disc height, degenerative disc disease, these are all synonymous terms. These are all signs of arthritis, the bone spurs, the degenerative disc disease, right? Osteoarthritis is specifically related to trauma or repetitive stress, as well as too much weight that we're carrying on our bodies predisposes us to osteoarthritis. Like I said before, synonymous with degeneration or degenerative disc disease. Okay, don't let someone fear monger you when they say you have degenerative disc disease. It's not good, but you're not going to croak out and go to the grave, right? Sometimes patients come in, they're like, "My doctor says I have degenerative disc disease." Like, you're going to make it. It's okay. It's okay. 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 So how do we? Sydney asked earlier about testing as far as when did they start testing? I don't know, but the types of. Hey, there you go. Late 80s. So the primary tests that they do to test our bone density is through a DEXA scan. Stands for dual energy X-ray absorption Absorptiometry, say that 5 times, right? That's what we call it DEXA. So this measures the calcium in our bones and it assesses the strength of risk for a fracture. So has anyone ever had a DEXA scan? Okay, like 80% of the room. Okay, so you guys have probably seen these types of scores before. We got T-scores and Z-scores. I didn't put the Z-scores up here, but what a Z-score is looking at, it's measuring your related risk of fracture relative to someone your age. Okay, a T-score compares your bone density to a healthy adult. Okay, so if you have a -1, if your T-score for bone density is equal or greater than -1, so if you have a -1 or a 0 or a 1, you're good. Okay, if you have a -1 to a 2.5, you're in the osteopenia range. And if it's more or less than -2.5, there are certain areas that are osteoporotic and you have an increased risk of fracture in those areas, right? So let's go over some lifestyle tips, okay? What causes bone loss? Okay, so medications that we put in our body. So if you're on a statin, an antidepressant, and acids, erectile dysfunction medications, these have been shown to decrease the body's ability to absorb vitamin K and vitamin D. Vitamin D helps our bodies absorb calcium, right? And what vitamin K does, vitamin D helps break down the calcium. If you think of a calcium, just think of a big rock. Vitamin D is the chisel, breaks it down. And then vitamin K is a big truck that transports it. That's why you hear you should take vitamin K with your vitamin D. Has anyone ever heard that? Right? So these types of medications, they block the effectiveness of vitamin K and vitamin D. Now, there are certain lifestyle habits that, hey, a statin, that's for cholesterol. If we can start to focus on our diets, hey, we could possibly get off of our statins, right? Antidepressants. Anyone ever heard of a meta-analysis? Meta-analysis. Okay, what a meta-analysis is a very large study that looks at a lot of other studies, okay, like randomized controlled trials. Meta-analysis is the gold standard of research, okay? Meta-analysis, when it comes to the effectiveness of antidepressants on making you happy, right? Meta-analysis, what that shows is they have no more benefit in actually helping you be happy than placebo or sugar pills, okay? Antacids, right? These have all sorts of, they actually do have calcium in it, but it actually, weirdly enough, it changes the pH of our stomachs and causes us to not fully absorb certain nutrients, okay? Okay, corticosteroids like prednisone, okay? Corticosteroids do have a direct effect on decreasing our bone density, okay? Has anyone ever heard this type of script before? I'm going to give it to you. Here's a script. Okay, patient has low back pain, they have knee pain, they have shoulder pain. You go in, you're not getting results. They say, okay, we're going to give you the shot. We're going to give you a cortisone shot. We're hoping that this works, but in the event that it doesn't, in about 2 weeks, if it doesn't work, we're going to recommend surgery. Has anyone ever heard that? Okay, they know it's not going to work, guys. What they're doing is they're prepping you for surgery. This is simply masking the underlying issue, okay? And it has a direct effect, but also when you think about it, if you are masking the body's natural response to alerting you that you have pain and you're completely getting rid of that, let's say I have a bum knee and I get a cortisone shot in my knee and I'm like, you know what, my knee feels so good now. I'm gonna go in the garden, I'm gonna start walking. What are you doing to that knee? You're overworking it, right? You're prematurely wearing it out even more because you haven't fixed it, right? So cortisone shots have a direct effect as well as side effects of bone.
So then what's the alternative?
That's a good question, Julie. So you have to get to the root cause. So for some patients, again, this is why we're so advocates of getting your spine checked. When we think about extremities, the spine, the knees, get that stuff checked early. Don't wait until you're 50 years old. Get it checked when you're a kid. That's the alternative. That's the proactive approach to this. The other alternative is you have a limited amount of there is a law of limitation of matter. Okay, so for instance, if someone came into the office and they have a broken arm, and they say, my arm hurts, Dr. D, can you adjust it? I'd say, you need to go to the hospital. You have a broken arm, right? When we have too much damage to a knee or an extremity, we've reached a limitation of matter, and the only option there now is surgery, unfortunately. Does that make sense, guys? Right? This is why we have to be proactive and be aware of these things. Okay, so corticosteroids are used to reduce swelling and inflammation. The long-term use leads to bone loss. If you have had cancer, IBS, Crohn's disease, asthma, eczema, psoriasis, dermatitis, degenerative disc disease, tendonitis, arthritis, you may have been prescribed a cortisone steroid. Yeah.
I can just add to that too. A lot of times because of the insurance companies, the doctor has to do all of the non-surgical things first. And so corticosteroids, insurance companies want this used before they'll okay a surgery.
I'm so glad you just said that. Did you read my notes? You don't guess what the next slide is, guys. Okay, this next slide is going to freak you guys out. Okay, so one of my colleagues, her name is Emily. She's a chiropractor in Colorado, and she sent us a picture. This was like a year ago. This happened this last year in March. One of her patients comes in, had a cortisone shot in her hip, and she comes in crutches, and she says, I can't walk, I'm having severe pain in my hip. Okay, so insurance, they mandated that the lady have a cortisone shot in her hip before a hip replacement. Just like what Carolyn said. Carolyn's a former nurse. Okay, she knows all about this stuff. Okay, so she comes in the office on crutches. Now it's hard to see in the back, but right here, this is her first x-ray. This was done in March. Can you guys see, this is her femur? Can you guys see that? Right here is the femoral head. Okay, this x-ray was taken in June. Notice that she also has hardware in her back. She's got rods and screws, spinal fusion surgery. Do you guys see a femoral head here? She has no femoral head. In 4 months from cortisone injection, she had an adverse reaction and the femoral head completely obliterated. And she came into a chiropractic office trying to get help for her hip pain, and they wanted to take an x-ray. They said, what the heck, you don't have it. She's just limping through with her leg not attached to her, right? Now you have people coming into chiropractic office. Guys, we get calls from people all the time. Hey, when can I get cracked? Can I just come in and pay you guys like $50? Oh, well, we want to take x-rays first. Why do I have to take x-rays? Right? Right. These are the short-term effects that can be very severe in patients when it comes to cortisone or corticosteroids. So I always tell patients, I want to help you the best that we can. There could be a law of limitation, like Julie was asking, like what is the other alternative? It stinks that, a lot of people do dictate what they do based off what the insurance company says you can do, right?
What's cortisone do to reduce the pain?
Not to get crazy scientific in it, Murray, but it simply blocks the pain signals. There's certain cells that have a certain pain signal that they send to your body. It goes in and it blocks those pain signals so that you do not feel the pain. Does that make sense? Okay, so what causes bone loss? Number 3 is hormonal changes. So postmenopausal females see a dramatic decrease in estrogen after 50. Men also see a decrease in estrogen after 50. So men and women both have estrogen, women at higher levels. Women have a drastic decrease in that estrogen after 50. Estrogen is the primary culprit of bone loss when it comes to hormones. Okay. Did you guys know that estrogen is made out of cholesterol? Okay, so when we think about hormones in our body, 90% of the hormones that our body creates is built from cholesterol. Okay, cholesterol is good when it's at the appropriate level. Okay, when our bodies go through menopause, there's certain I'm going to show you in a second, but there's certain organs that are responsible for creating estrogen and build off cholesterol. When our bodies are very stressed, when we're not doing the right things, when we have a poor diet, when we don't exercise, when we have a lot of mental stress, our body creates more cholesterol because we need to build our hormones from that. Does that make sense? Right? So when we go to the doctor and they said, your cholesterol is elevated, here's this pill, what should you ask? Why is it elevated, doctor? And they're going to say, I don't know. My script is to give you a pill. Does that make sense? Am I getting you guys to think a little bit? Right? So our estrogen is based off of cholesterol. So this sounds kind of crazy, but when we get older, we should eat more foods that have higher cholesterol so we can build more estrogen. Right? You guys following? Okay. Now you cannot get cholesterol from plants. Okay. You get cholesterol from meats. We get this through eggs, which are animal products. Okay. So we need to start to increase the amount that we're having. Okay. Okay. Like I said, remember, cholesterol is not bad. It's only bad when it's way elevated. And then we got to start asking the questions why. Now, 2 months ago, we did a food label workshop, and it's recorded and it's on our YouTube page. And if you want to learn more about what types of foods have cholesterol, the effects of what cholesterol does to our bodies, and how to read food labels, go on YouTube and watch that workshop. It's about a 50-60 minute workshop. Yep. Go ahead, Julie.
Do you have raw cheese, Dan? Regular cheese does not have cholesterol?
It does, Julie. Good find. So Julie noted that I put raw cheese here. At that workshop, we talked about the benefits of raw cheese. And when it comes to raw cheese versus pasteurized cheese, raw cheese is far superior in the amount of nutrients in it, as well as probiotics. That's why I recommend raw cheese versus or pasteurized. You can get raw cheese. You can get a big block at Costco. Okay, it'll say, if you read the ingredients, it'll say non-pasteurized or raw cheese. If you're a shopper of Whole Foods, they have a little circular sticker on there that has a little milk jug and it says raw over it. That's how you know it says it's raw cheese. Okay. Now, this is what happens with the hormonal changes. So, so this is specifically talking to the females. Okay, so ovaries are the main organs in our body that create estrogen. But after menopause, the ovaries stop working, essentially. Okay, and then now our adrenal glands are the sole source of creating estrogen. Who remembers what the adrenal glands do? It's in the name. Adrenaline, right? Okay, good. We all know, right? So adrenaline is a stress hormone, right? Has anyone ever heard of adrenal fatigue? Right, adrenal fatigue. So what's happening is your adrenal glands are on overload now because you're really stressed and you're creating all these, you're creating adrenaline, you're creating cortisol. It's now primarily given the task of being the main thing that creates all your estrogen as well, right? So these are the types of things that we need to start looking at, especially even before we're 50, to start, hey, what can we do to support our adrenal glands? Are there certain supplements? Are there certain foods that can help prep our adrenals because they're about to go through, you know what, once we turn 50? Okay, poor diet. So high sodium foods increase calcium excretion in our urine. So when not to say that salt is bad, we need salt, guys, but sodium is not salt. Sodium is one component of salt. Magnesium, potassium are all other components of salt. Okay, so the types of salts that we eat, we want to make sure that they're low in sodium, high in magnesium, high in potassium. The higher sodium that we consume, the more calcium we're going to push out through our urine, which is not beneficial for our bones. Everyone with me? Okay. We want to be under 2,300 milligrams a day for sodium. Okay, sugar sweetened drinks. So I put specifically sodas like Pepsi and Coke. These contain what are called phosphoric acid, which disrupts our calcium absorption. Okay. It's one thing to consume calcium, but if we can't absorb it, what's the point, right? Okay, excessive caffeine. Studies show that 300 to 400 milligrams of caffeine daily, which is about 3 to 4 cups of coffee, can contribute to bone loss. Okay. Alcohol, more than 1 drink per day can impair bone-forming cells and reduce calcium and vitamin D absorption. I think we all know that alcohol is a poison, right? Limited amounts. Okay. Has anyone ever heard of oxalates? Oxalates. Okay, this is going to be interesting for you guys. Okay, so what oxalates do, they're found in plants. These are natural forming compounds that are found in plants. And what they do is they bind with calcium, and they essentially cause calcium to clump up, okay? And when calcium's clumped up, we can't break it down. It's harder to break down, okay? And patients with diets that have high oxalates and are low in calcium tend to have blood circulation issues, and what these oxalates do is they form what's called oxalate crystals, which form kidney stones. Is everyone familiar with that, right? Okay, so what foods are high in oxalates, Dr. D? I'm glad you guys asked. It's going to sound crazy. Really healthy foods. Now, don't get ahead of yourself. One of the foods with the highest amounts of oxalates on here is spinach. Okay, we also have kiwi, beets, potatoes, sweet potatoes, figs, star fruits, rhubarb, pomegranate, chocolate, nuts, seeds. These are all very high in oxalates. Okay, foods that are low in oxalates: cauliflower, cucumber, kale, red bell pepper, avocado, blueberries, cherries, apples, coconuts, meat, right? Those are very low in oxalates. Now, I'm not saying stop eating spinach. I love spinach. I eat a spinach salad at least twice a week, at least twice. But if you consume a diet that is high in oxalates, you want to also consume high calcium, right? So, for instance, if I had a spinach salad, what I would do is I would go to the store and get some, maybe some raw cheese like feta cheese or some Gouda. Put that in with my spinach salad. Right now I got oxalates in there. I want to limit that to 1 to 2 cups a day, but now I have something to kind of counteract that and keep my calcium levels high. Does that make sense? Right? Cool. Okay. Foods high in calcium. So I've been saying this, here's a brand right here. You can get this at Whole Foods. Organic Valley. This is a raw cheddar cheese. And just because it says raw, it tastes exactly like cheddar cheese. There's no difference in taste. Don't freak out. It's the same taste, right? Kale, broccoli, collard greens. These are very high in calcium. Sardines, salmon. These are also very high in calcium. Okay. This is also an interesting one. Stay away from calcium supplements. Calcium supplements, 90% are made out of calcium carbonate. You guys would have similar benefits of what those supplements provide you if you just walked out in the parking lot and start chewing on the gravel in the parking lot. Seriously, it's literally limestone. That's what it is. So there's lots of studies that have shown a link between patients consuming calcium supplements and how that can attribute to further atherosclerosis and problems with our kidney function and heart failure. Okay. It is way more superior to be getting natural calcium through our diet and not supplementing with that.
How about milk pasteurized compared to, like you said, cheese?
Mm-hmm.
Milk free. Well, you can't really get raw milk.
Good question. So in this state, you cannot buy raw milk at a grocery store. You can only get it at the farm that produced it. But you can get, for some reason, you can get raw cheese. Maybe the shelf life is better, and that's why you can't. It takes too long to finally get to the store. But there is a farm about 30 minutes south of here called Manly View Farms, and they produce raw milk. And you can go in and buy your raw milk and peace out, and now you got raw milk. But yeah, there's going to be calcium and calcium enriched milk that we get at the store. That's okay, but mainly through different food sources than just milk. Okay.
How about like 1% versus whole milk?
So that's going to be looking at more the fat content within the milk.
Yeah,
I'm not sure as far as the calcium for sure on that.
I'm convinced that whole milk's a lot better than any of those.
I am too. I like the taste of it more, but
I think it's better.
I like whole milk a lot. Yeah, good question. So let's talk about some things that can strengthen our bones. Okay, I want to talk about this concept first. Okay, so like the first day you walk into chiropractic school, they slam the book down. They're like Wolf's Law. Let's talk about Wolf's Law. Okay, so Wolf's Law is any living tissue or organism, when there's stress put on it, it's going to adapt to that stress. Okay, so the number one thing that you guys, I know I've been talking a lot about diet, but the number one thing that you guys can do, the research shows, is resistance strength training is the number one thing to improve your bone density due to Wolf's Law. When we put stress on the bones, like a physical weight bearing stress, the bones feel that stress and they adapt and become resilient to that stress. Does that make sense? Okay, so what I did, this is like my first time using AI for research. I went on my X account, and I looked up, I said, okay, X, I want to know all the research about what types of exercises do give you the most benefit for bone mineral density. I want you to look at all the meta-analysis. I want you to look at the most recent research, and I want you to compare and put this in a chart for me to show what's the best type of exercise and what gives you the best clinical outcomes. So what X did for me is they put a study from 2015 that looked at patients who solely did yoga in comparison to bone strengthening, ones that did walking, ones that did strength training, and there's also a 2020 meta-analysis sprinkled in there that looked at like 20 to 30 other studies. Okay, so this is a pretty good graph. Okay, and it compares the benefit of different types of exercise. So if you did no exercise at all, okay, and you're over 50 years old, you're most likely going to experience a -1 to -1.5% of bone loss every year. Okay, now compare that to walking. Walking would be, here, I'll go from worst to best. So cycling, if you just solely do bicycling, that's the worst clinical outcome when it comes to exercise. It's still better than doing nothing, but you're not really gaining much at all if you're just cycling. Okay, the next best option would be to do yoga. Okay, yoga, you only get a -2% versus a -1% loss. Walking has showed to improve the strength of the lumbar spine, the lower back, you actually get a 0.1% improvement from just walking. Okay, the best strength training, 0.8% to 1.2% increase. Okay, so by far resistance training, picking up weights, that's going to give you the best clinical outcome for strengthening your bones. Okay, let's talk about some different foods and supplements.
Is that just the bones that you're working out with, or all your bones?
Well, it's gonna be the ones that you're targeting. So that's why you're gonna need to do some squats with weight. You're gonna need to do biceps, do some bench press. You're gonna have to get a workout that is conducive to what you can do. And for some patients, sometimes that can be pretty daunting. Like if you've never been in a gym before, it's like, well, I don't know what my spine can handle. Like maybe you need a personal trainer. This isn't on here. I'm not paid to even say this, but one of the places I really love referring patients to here in Omaha is a place called the Exercise Coach. Have you guys ever heard of the Exercise Coach? Okay, this is for their business demographic is for people over 40 years old who don't really like to exercise that much, who don't have a lot of time, but want good clinical outcomes to improve their bone density. So they do twice a week. You work out for 20 minutes. They put you on these really amazing, like laboratory-made machines, and you get to see, it's kind of like a video game that you play, and you get to do bench press, you get to do squats, you get to do all sorts of things, and you get to see your results improve week by week. You can see your scores improve. And it's really, I really like it because you have someone there monitoring you. You can see your progress. It's not throwing crazy weights over your head, right? It's less likelihood of injury. So the Exercise Coach, I know that they have several locations around town. I really recommend checking them out. A place here in Papillion that I refer patients to as well is Club Pilates. Pilates is very spine centric. They have many locations around here as well, but Pilates, exercise coach, hiring a personal trainer, those would all be options that I would look into if you're not really confident of what to do when it comes to going in a strength and conditioning program in the gym. Okay, so some food and supplements. So yes, vitamin D is a very good source for helping calcium. Now, something that people aren't necessarily aware of, if you were to look at your vitamin D bottle, and let's say the primary measurement for vitamin D is IUs, and if you see 600 IUs, on the right side, it'll say that's 100% of your daily recommended amount. Does that sound familiar at all? Okay. That research and information is based off of about 100-year-old research when they were referring patients to take vitamin D because of their rickets that they developed for being malnourished through the Great Depression. Okay, so that is very old research. That is still, whatever reason why, it's still recommended to people. So when I tell people, my recommendation is 10,000 IUs a day, and people are like, whoa, that's like crazy. If you were to go on the beach and you were to be in a swimsuit and you're out in the sun for like an hour, 2 hours, you'd get about 20,000 IUs of vitamin D. Someone with my skin complexion has more melatonin or melanin in the skin. Our skin acts as a sun blocker, and we actually don't get as much vitamin D as someone with fair skin. So we need even more sunlight. Vitamin D's role, like I said, is to break down calcium. If you're taking a vitamin D supplement, 10,000 IUs, you're 20 times more efficient at absorbing calcium. 20 times more efficient. Okay, but go ahead.
I mean, it's also good for your immunity to have your vitamin D up there.
Yes.
If your doctor will check it, you want it between like around 8 at least.
Mm-hmm. So vitamin D, like you and I just named off like 2 benefits of vitamin D. There's like 10,000 benefits of vitamin D. And because we live in this part of the world, 3/4 of the year, we don't get enough sunlight. And I would imagine that if maybe not in the summer, but if I took everyone's blood levels and checked your vitamin D, if you're not taking vitamin D, you're probably very deficient in it. Okay. We can primarily only get vitamin D through the sun. Okay. Vitamin K, like I said, it delivers calcium to the bones. We get vitamin K through foods like broccoli, collard greens, eggs. Vitamin K and A, again, are best if we eat these. It's way better if we eat these versus supplementation. Vitamin A influences bone remodeling. We get this through foods like liver, fish, carrots, raw dairy. You guys notice how there's kind of like a color theme with the different vitamins? So when you see something orange or yellow, you're getting a lot of good vitamin A. If you're eating green food, you're getting a lot of good vitamin K. Now, one side note, my mind goes all over the place when I'm making these slides. Okay, have you guys ever heard of fat-soluble and water-soluble vitamins? Okay, fat-soluble vitamins are A, D, E, and K. A, D, and K, that means that you need to be able to break down the fat that's in them so that you can use it. Those that don't have a gallbladder, these supplements don't really matter that much because you can't break it down. So what I suggest for patients who don't have a gallbladder is your doctor should have told you should be taking bile salts because your gallbladder is what concentrates bile. And because you don't have it anymore, you don't have concentrated bile, thus you need to take bile salts for the rest of your life. They don't tell patients that, right? So Dr. Berg, go on Amazon, type in Dr. Berg. I don't get paid for this. Type in Dr. Berg bile salts, and you'll thank me later because now you won't have diarrhea when you eat a steak. Right. Okay, more food and supplements. Okay, vitamin C helps with collagen and calcium synthesis. So you guys are probably familiar with scurvy, right? Okay, the pirates back in the day, they didn't get vitamin C. They started bleeding through their gums because the collagen strands started to separate and then they bled. Okay, so vitamin C helps synthesize collagen and bone formation. Okay, we get vitamin C. The highest concentration of vitamin C, this is surprising to most people, are from dark leafy green vegetables. Vitamin C, dark leafy green vegetables. We do get this from oranges and so forth, strawberries, kale, broccoli. Now again, you know, it's not really needed. If you don't have a really good diet, then yeah, you need a supplement. But when you supplement, you need to also know what's in your supplement. Go back to the food label workshop. Okay, ascorbic acid. Okay, we talked about this in the last workshop, but ascorbic acid is like 99% of vitamin C supplements. This is a synthetic form of vitamin C that our bodies can't absorb. So we want to take, we want to get stuff. This isn't listed on here, but if you read the food label, it'll say like camu berry. Camu berry. That's a common extract that they literally derive from that type of berry that has pure vitamin C in it. It's a way superior than ascorbic acid. Okay. Okay, collagen. We talked about collagen already, but you can take this in the form of a supplement. Okay, now this is good. We have this at home, but collagen is made from amino acids. Amino acids come from meat. So if you want to get the best, purest form of collagen, you need to be consuming meat. This is okay, but again, when we talk about can you actually absorb this appropriately, meat is far superior than just taking a supplement. Okay, we also get collagen through bone broth. So some of this is, you guys know when when you're sick, your parents said, hey, you should drink some chicken noodle soup, right? So in the way early days, they put the whole animal in the soup and they boil it, and it breaks down all the collagen and the ligaments and some of the bone material. And then you drink that, it helps repair your gut, right? That's why bone broth is really good for not only our bones, but our immunity, okay? Okay. Lastly, chiropractic care. You guys didn't think I was going to forget this one, right? Okay, so we often talk about chiropractic care in relations to subluxation, bones being misaligned, restoring proper communication from the brain to the rest of the body so that your brain can properly communicate. But let's go back to Wolff's Law for a second. When we think about certain repetitive stresses and how our bones form to that, could you guys give a real world example of Wolff's Law? This isn't, the reason I use this trees over time, if they're exposed to crazy wind conditions, they still grow, but they form and they adapt to that. That's Wolff's Law in nature right there. What would be a real world example of Wolff's Law, but with our bodies? There you go, Barb. Phone, right posture. Looking down like this. Over time, a stress or a force that's applied, the body changes and adapts to that and is now formed to that type of position. Okay, so this is, I took a screenshot of an x-ray. Here's an example. So right here, this is L1. This is in a patient's lower back. Okay, you see how it's nice and square? Okay, right here, you guys see how it forms at a kind of a wedge? That's called a compression fracture on x-ray. You see these kind of pointy edges right there? That's Wolff's Law in action. That's bone spurs forming and outgrowing because there's stress put upon it. We see these in patients. Now you can have traumatic stress fractures. You've been in a car accident. That was a force that caused it to change. We see these in people who sit at a desk like this all day. That's a force over time that's causing it to change. Or if you have too much weight on your body, you carry too much adipose tissue, that is a force that you're putting on your body. It's literally causing the spine to shrink in size. Okay. So I want to show you guys a cool patient testimony. This patient, his name is Wyatt. Wyatt is 89 years old. He's been coming here for about 3 years. His daughter, she owns a mattress company, and he was at 86 years old helping his daughter move mattresses. Okay. So he comes into the office with a walker, and he has horrible sciatica pain all the way down his butt, into his leg, into his foot. And this is a picture of him when he first came in. Okay, so you guys can see he's very crooked. He has a 38-pound weight difference towards his right side because all of his pain was on the left and he was leaning away from it. 3-inch difference in his shoulders, 2.5-inch difference in his hips. Now, if I showed you his x-rays, this is an 86-year-old, so you can assume that he has bone loss. He also has compression fractures throughout his spine. And this is where we got him in 4 months. We saw a 2-inch improvement in his shoulders, his hips fully evened out, and his weight distribution fully evened out. Now, this was him from his side. He had 8 inches of forward head posture. This was him at 4 months. Now, he just had his annual exam not too long ago, and he's now at 1 inch. I wanted to show you that, but this is like how fast people can change when we start applying a specific force over time. That's how Wolff's Law can benefit you over time. If we apply the right forces, we can help change, how the bones are formed. Okay, so the purpose of a chiropractic adjustment, right, is right, we want to restore natural motion to the joint. Okay, we talk about a misalignment. This is a misalignment is a lot easier for the layperson to understand, but it's like fractions of a misalignment. More so, a subluxation is a joint that's lost proper motion of the joint. Okay, when we restore proper motion, that leads to less premature damage. When we apply a specific force, we have less damage in the spine or less progression of that damage. Hey, if you start to feel better and you have, we've slowed down that progression, people start getting out of pain, and even the patients that don't have pain, when they first came in, they say, hey, my range of motion feels better. I feel more fluid. That means you're less predisposed to injuring yourself when you do resistance training. Now, when you do resistance training, you build more muscle. You cut the fat. Now, because you have less fat, you get better bone strength. You guys see the indirect benefits of getting adjusted, right? There's not direct benefits, but there's indirect benefits of getting adjusted over time, okay? So, when's the best time to plant an oak tree, guys? 50 years ago or right now? 8 years ago, yes. Awesome. I know that we just went through a lot, guys. Did anyone find anything new or interesting that you didn't learn before? I saw like a lot of eyebrows raising and like oohs and ahs. Is there anything that's kind of got you guys to start thinking that you may have not thought before, or what's a priority? I'm curious. Any questions you guys have?
Just stop taking calcium supplements. Antacids are not good.
Yep, antacids, not so good.
Go suck a rock.
Yep. Go suck rocks. That's what Dr. D said. Okay. Anything?
When they eat more meat, you're not talking hamburgers and
Ground beef is good.
ground beef, okay?
Yeah.
Any kind of meat. But you prefer fish.
Okay, so we don't want to eat processed meats, right? So a processed meat has lots of nitrates and a bunch of added chemicals and stuff like that. But if I were to say, okay, what type of meat do you want to eat? You want to read that food label, and just so you guys know, when you see grass-fed is the best type of meat, right? But it should say 100% grass-fed. They do this type of word soup that if it doesn't say 100% grass-fed, that means a little bit of grass was fed. Do you guys see how deceiving they are? Right? So 100% grass-fed beef, pasture-raised, that's great. If let's say the same thing with the eggs that you're consuming. You want to have, pasture-raised eggs. Those are going to be the best versus just cage-free. Cage-free means, they could still be in I don't know, some crazy confined space where they're all pooping on each other and it's this horrible environment, right? Any other questions? Yeah.
I just have a question you talked about the bone marrow
Yep.
at the beginning, and I'm wondering how osteoporosis, or if it affects the bone marrow.
and stuff?
That's a good question. I don't have a direct answer that I'm confident of giving you with that. I would love to find that answer. I would assume there would be some effect. When we talk about bone marrow, if you have everything is connected, we know that, and if there is a weakness to the bone density, I would assume that the bone marrow would be affected in some capacity. So I don't have a clear answer for you on that, but good question. Any others? I saw some other hands raised.
Well, I think the media, they would like us to not eat any meat. They almost make it sound like you should just totally do away with it. It's a poison practically. Really. And I totally disagree. Because I eat a lot of red meat. I'm as healthy as I ever was.
It's like you can be on one fence or the other. And I'll say this, classic advice of eating a balanced diet is still true. Like that's what I believe is eat a balanced diet. Because you guys saw me talk about the oxalates, right? You can find a negative thing for almost anything, but if you have something to balance it out, you're not going to have a problem. But if you go too much on one end and too deficient on the other end, right? Like for instance, someone who's a vegan, they are completely they're only eating plants. They're not doing any animal products. That person has to go on the other side of the spectrum to take so many other supplements because they're so deficient in the main supplements that they should absorb, but they can't because they've completely neglected a whole portion of their diet, right? So you won't hear me ever say go completely vegan. Vegetarian is great, but we need to have some balance because there's going to be blind spots. It's going to be that much harder. And I'm someone who doesn't like to work that hard. Like you guys may be surprised. I don't like to think that much, right? But if we just do balance, we don't have to think that much, right? Good question. Any other questions?
So if you are a vegetarian, you're just out of luck as far as collagen.
So I would say yes, right? Collagen does not come from plants. You have to consume meat products or I don't know as far as how much collagen would be in an egg. I'd have to look to see, okay, how many eggs do you have to eat nowadays? Do you need to eat 12 eggs, right, to get the same benefit of collagen if you just ate one patty? Right, that's the pro and cons with this, right? So it's like how much now that you're this is how much more you have to do to keep up with the others to reduce bone loss. Right now, if you're not eating this nutrient, now you have to go in the gym this much more than the other person that's actually consuming meat because they're getting it more readily available. Does that make sense? Right? Good question, Julie. Any other questions? You guys have had a lot of questions. This is entertaining for me. All right, guys. I hope you learned a lot tonight. Thank you, guys. Have a great night. Woohoo!